Hi, everyone. This is Maureen Ritchie at the Council of State Governments Justice Center. Thanks so much for joining us today for the webinar Homeless Services 101, What Reentry Service Providers Need to Know. I'll be facilitating the webinar today along with my colleagues Mary Owens from the U.S. Interagency Council on Homelessness, Jamie Day from the National Alliance to End Homelessness, and Kim Keaton from CSH. So just a little bit of background information before we get started. I'm a policy analyst with Council of State Governments Justice Center. The CSG Justice Center is a national nonprofit organization that serves policymakers at the local, state, and federal levels from all branches of government. Staff provides practical, nonpartisan advice and evidence-based, consensus-driven strategies to increase public safety and to strengthen communities. A little bit of an overview for today. First, we're going to look at Homelessness Services 101. Then we're going to learn a little bit more about continuums of care and reentry. And finally, we're going to hear a Fuse program model example from CSH. There will be time for Q&A at the end. A little bit of housekeeping and the agenda for today. This is a 90-minute webinar. It's scheduled to run from 2 to 3:30 Eastern Time. The webinar is being recorded, and it will be posted to the CSG Justice Center website at a later date. All phone lines are on mute except for the presenters. The Q&A session will be at the end. We have a lot of people dialing into this webinar. We assume that there will be a lot of questions, so not all of your questions might be answered. Please do feel free to ask them. We still see them. And hopefully, any unanswered questions, we'll use those as guidance in thinking about future webinars that we want to put on. If you do have questions or concerns or technical difficulties, please type them into those boxes on the bottom right-hand side of your screen in the WebEx. And just one other side note, there will be a very short survey that pops up at the end of the webinar after we close out. Shouldn't take you more than a few seconds to complete, just sort of about who you are, your organization, and what kind of topics you'd like more information on. Please do take a second to fill that out. It helps us plan content in the future. And so with that, I'm going to turn it over to Mary Owens from the U.S. Interagency Council on Homelessness. Mary, please make sure your line is unmuted, and if you have any questions, let me know. Other than that, I'll hand it over to you. Thanks, Mary.
Thank you, Maureen, and good afternoon, everyone. I'm really pleased to be here today on behalf of the U.S. Interagency Council on Homelessness. So today I'm going to take a few minutes to provide some framing from the federal perspective, focusing on efforts to help people returning from incarceration access housing in order for them to successfully reenter into our neighborhoods and communities. I'll start with some basic facts about homelessness and how it intersects with the criminal justice system. I will also highlight how efforts are underway at the federal level to reduce homelessness among people reentering, and then discuss the critical role housing plays for individuals returning from incarceration. Let's get started by first discussing what homelessness looks like in the United States. So in 2015, the annual homelessness assessment report estimated that approximately 565,000 people were identified as experiencing homelessness on a given night in January 2015. 31% were found in unsheltered locations, and nearly a quarter were children under the age of 18. This is partially attributed to housing affordability and really the lack of affordability across the United States. In order for someone in the U.S. to afford a two-bedroom apartment, they must make approximately $39,000 a year, which is the equivalent of a full-time job paying an hourly wage of $18.92 an hour. The average renter in the U.S. has a full-time job with an hourly wage of $14.65 an hour. So what this means is that a family with one full-time worker earning minimum wage cannot afford local fair market rent for a two-bedroom apartment. And this is especially true for a very high market area like San Francisco, Washington, D.C., and New York. The federal government is responding to the challenges of homelessness, and leading this effort is the U.S. Interagency Council on Homelessness. Our agency is charged with leading the federal response to prevent and end homelessness, and we do this in coordination with 19 member agencies. Our current chair is Secretary Burwell from Health and Human Services, and our vice chair is the Secretary of Education, John King. Our role is to create and lead a common vision to end homelessness across the federal government, establish priorities, reduce fragmentation and duplication, and drive the national implementation of cost-effective solutions at the national level. Our work is guided by Opening Doors, which is the federal strategic plan to prevent and end homelessness, which was launched in 2010. In fact, today is actually the 6th anniversary of Opening Doors. Opening Doors outlines the actions to achieve 4 bold and measurable goals. Prevent and end homelessness in 2015, finish the job of chronic homelessness in 2017, prevent and end homelessness among families, children, and youth in 2020, and then set a path for all types of homelessness. The results are clear that Opening Doors and USICH's implementation of the plan are working. According to HUD's 2015 point-in-time count, the total number of people experiencing homelessness at a given point has been reduced by 11% since 2010. Further unsheltered homelessness had been reduced by almost 26% over the same time frame. The data shows that veteran homelessness was reduced by 36%, including a 47% reduction in the estimated number of veterans experiencing unsheltered homelessness. Chronic homelessness was reduced by 22%, including a 13% reduction in unsheltered chronic homelessness. And families with children experiencing homelessness was reduced by 19%, including a 64% reduction in the number of families experiencing unsheltered homelessness. And while we've made significant progress, there's clearly more work to be done across many federal agencies to achieve even greater reductions in homelessness. Despite our progress in reducing homelessness, however, criminal justice involvement among people experiencing homelessness remains a huge problem. This next section looks at homelessness as it relates to incarceration. So we know that there is a significant overlap among people with criminal justice involvement and people experiencing homelessness. Homelessness and criminal justice involvement are actually bidirectional, and this means that homelessness increases the risk of criminal justice involvement, and criminal justice involvement increases the risk of homelessness. And as you can see from our picture here, estimates project that 15% of people experiencing homelessness have a history of incarceration, and as many as 48,000 people who have entered homeless shelters in 2013 came directly from jails or prisons. The risk is higher among people with serious mental illness and substance use disorders. As many as 1 million adults with serious mental illness are booked into jails annually, and many of these individuals have experienced homelessness. Homelessness is especially high among people being released from prison. It is estimated that 50,000 people enter shelters directly from release. This is attributed to the fact that people leaving jails face housing and employment challenges due to their criminal history. Unfortunately, reentry programs and services fall short of meeting housing needs for those reentering. Reentry programs and services have increased dramatically in recent years, in large part due to Second Chance Act grants. SCA funding can be used for supportive services, such as case management, employment, and education and housing-related services and programs, but it cannot be used directly to cover the cost of housing or rental assistance. Meanwhile, resources remain a challenge, as all forms of federal housing assistance are insufficient to meet the need. Now that we've examined the problems underlying reentry and homelessness, let's turn to the solutions and ways to address criminal justice involvement and homelessness at the federal level. Reducing homelessness among people returning from prisons requires leadership at the federal level, especially given that many of the problems stem from unanticipated consequences of state and local policies. The Federal Interagency Reentry Council, led by the Department of Justice, convenes 20 agencies to coordinate federal efforts to reduce recidivism, assist those returning from prisons to become productive citizens, and save tax dollars by lowering the cost of incarceration. The Council is charged with improving employment, education, housing, health, and child welfare outcomes for individuals returning from incarceration. In 2016, the Department of Justice published a roadmap to reentry tool, providing guidance to the Federal Bureau of Prisons on how to reduce recidivism and prepare motivated individuals for successful reentry into society. These correction principles span the cycle of custody and provide guidance from intake to incarceration and through release. The roadmap to reentry encourages prisons to provide every person leaving custody with an individualized reentry plan tailored to his or her risk of recidivism. It is critical during the reentry planning phase, prisons include housing-related screening and assessment. Evidence shows that people who find safe, affordable housing after they are released from prison are significantly more likely to find a job and stay out of trouble. Moreover, housing results in public cost offsets as much as $15,000 per participant per year. So we've established the importance of housing as a solution to reduce recidivism and homelessness. Next, let's examine ways to connect people returning from incarceration with housing and homelessness assistance. So on the screen now, you're seeing the US ICH guidance that we released for correction agencies, reentry service providers, state and local governments, and community partners on how to help people exiting the criminal justice system connect to housing and resources. This resource suggests a range of housing programs that people returning from incarceration might be eligible to receive based on their need. The typology slide you're showing now shows the relationship between criminal justice involvement and housing and service needs. As you can see, people with higher housing needs, those with chronic conditions or frequent users of corrections, need housing that is more permanent in nature and tied to health services and supports. Conversely, people with low housing needs might need a lesser housing intervention, like rapid rehousing or family reunification. And then those in the middle with medium housing and service needs benefit from a myriad of interventions. And this includes affordable housing, rapid rehousing, and transitional housing. Over the next few slides, I will discuss in greater detail the housing typologies available for individuals with criminal justice involvement that are at risk of experiencing homelessness. So the first housing typology is really not a housing typology, but it's family reunification. And this is a family-based setting, and it's the preferred housing outcome for all individuals, but particularly for youth. This type of housing intervention is appropriate for people with low criminal justice involvement and low housing needs. It is only preferred, however, when it is safe and appropriate. Reunification can include biological family members like a parent or other relative, but it can also include social supports like friends. The next housing typology is affordable housing. Affordable housing provides assistance that enables you to pay no more than 30% of your monthly income on housing costs. Affordable housing is limited to low-income families and individuals based on annual gross income. Income limits vary from area to area, but there are two primary programs to lower the rent burden. The first is through capital program or project-based operating subsidies, and examples of this include low-income housing tax credits in Section 8, and then the second is through tenant-based subsidies. Notably, affordable housing is a mainstream program, and this means that it is not targeted specifically for individuals experiencing homelessness or reentering from prisons. The next housing typology is rapid rehousing, and rapid rehousing uses both housing and services to reduce time spent in shelter by providing time-limited rental assistance. The core service component of rapid rehousing also includes housing searches, landlord negotiations, and home-based housing stabilization services. Most communities fund rapid rehousing using federal resources such as emergency solution grants, the Continuum of Care program, and supportive services for veteran family grants. While applications for formerly incarcerated persons are limited for rapid rehousing, This intervention is highly effective for families and individuals with low criminogenic risk. Many communities operate transitional housing programs for people reentering from incarceration. Transitional housing can serve to bridge the gap between homelessness to permanent housing by offering structure, supervision, and support for some populations. Transitional housing is time-limited and includes highly structured residential programs. This is often a good fit for individuals struggling with substance use disorders and for people reentering because it gives them security and supervision. And then the final housing typology is permanent supportive housing. Permanent supportive housing is a housing intervention that combines non-time-limited affordable housing assistance with wraparound supportive health services for people experiencing homelessness. This type of housing requires communities to adopt proactive, assertive outreach, connecting people that are chronically homeless or frequent users of corrections with housing. Permanent supportive housing is often used for individuals with the most barriers to housing, and communities typically prioritize these interventions based on the objective measures of need, vulnerability, and cost. A great example of permanent supportive housing addressing homelessness and recidivism simultaneously are the Pay for Success demonstration grants. The demo, funded by HUD and DOJ, uses $8.7 million to finance programs implementing permanent supportive housing for people leaving jails or prisons, and will test cost-effective ways to help persons cycling between criminal justice and homeless service systems. So this concludes my portion of the presentation, and if you have any questions regarding my presentation or work that USICH and our federal partners are undertaking to reduce homelessness and recidivism, please contact me. My email address is mary.owens@usich.gov, and thank you very much.
Great, thank you so much, Mary. Next up is Jamie Day from the National Alliance to End Homelessness, who's going to be talking a little bit about continuums of care and reentry. So with that, Jamie, please make sure your line's unmuted, and I'll hand it over to you.
Thanks, Mary, and thanks, Maureen. We also want to thank the Justice Center for this opportunity. So hello, everyone. My name is Jamie Day, and I am the Policy Director for Individual Homeless Adults here at the National Alliance to End Homelessness. And as you just heard, having a criminal record or exiting prison or jail can be a big barrier to housing, and it puts people at risk of becoming homeless or staying homeless for longer periods of time. And while we welcome criminal justice reform, this likely means that a lot more people are going to be needing housing support. So this is why we're very excited to be presenting here today, because we want to help everyone form really good partnerships between reentry providers and homeless service providers. So my presentation will cover the way homeless services are organized at the local level, including housing targeted towards people experiencing homelessness, and how you can reach out and partner with your local homeless service system. So let me start out by telling you about our work. The National Alliance to End Homelessness is a national nonpartisan organization committed to preventing and ending homelessness in the United States, and we really do believe this is possible. At the Alliance, we identify policy solutions and promote them to the administration and to Congress and anyone else who will listen. We have a capacity building team that goes to communities to help them create better systems, and we provide data and information to educate opinion leaders about homelessness and housing as a solution. Most importantly, we learn from providers in the field about what is working and what is not working in order to inform our work. So how are homeless services organized? Long ago, the Department of Housing and Urban Development, or HUD, established what are called continuums of care, or CoCs. And these are groups of stakeholders in service catchment areas, such as cities, counties, and sometimes states. And stakeholders include nonprofits, public housing authorities, local governments, advocates, and consumers, and any other community-based organization serving homeless individuals. and they typically elect a person or organization to lead their efforts. So there are two main ways to think about a COC. The first is as a planning body. So COCs create and implement a comprehensive plan locally to end homelessness, and this crosses all funding sources and types of services. So basically whatever it takes is on the table. Second, the COC is also a funder. COCs apply for mostly housing dollars from HUD through an annual grant competition. And to my knowledge, this is the largest grant competition in the country. But the COC is a funder because it determines which programs and providers get included in that competition and who is prioritized for funding when there are fewer funds available from HUD. And I will talk about this a little bit more in a bit. So there are many reasons to reach out and work with your local continuum of care. And because it's a complex body, it helps to know about how they work and what they can offer you. First and foremost, continuums of care have housing resources, which is why I'm sure many of you are listening in today. Also, in order to end homelessness, COCs have to think big and broad, which means they're often very willing partners. Many of them may have already been trying to chase you down. COCs serve many of the same people that you do, so it should be a mutually beneficial partnership. And COCs are really good at using data and best practices, which are effective for the people they serve, and they also help to save communities money. And in the end, the biggest bonus of all is that when you work with the COC, you're helping to end homelessness. So the objective of the COC is really to end homelessness and to specifically end it according to the federal goals that Mary covered earlier. And COCs are very data-driven and are tracking several performance indicators to measure their progress. And these are system indicators that encompass all programs, not just individual programs themselves. And let's see, preventing recidivism is not an explicit goal in here, but it does work hand in hand with the goals to prevent and end homelessness. So COCs do a lot of work. First, they coordinate with other pertinent entities in many ways, and this includes creating discharge plans to prevent people leaving other systems and entering the homeless system. They determine unmet need for housing and shelter. They are constantly measuring and working to improve performance of programs and their system as a whole. They use best practices, such as a housing first approach. And housing first, this is where people are placed into housing first without any preconditions, such as sobriety or quote-unquote readiness for housing. And then once people are in housing, it's used as a platform towards other goals as the person chooses. And many providers have said that this has felt unnatural when they first switch to a housing first approach, but are often surprised by how successful people are once they're in housing. And both the Alliance and USICH have a lot more information and resources on the housing first approach if you're interested. COCs also administer the Homeless Management Information System, or HMIS, which collects demographic and service information for anyone who enters the homeless system. And most homeless service providers participate in this system if they're federally funded, and typically if they're state funded. They conduct an annual count on a single night of everyone who is homeless, which gives us a sense of the trends overall. COCs also advocate for funding and apply for direct funding. And finally, they are required to develop what's called a coordinated entry process. And I'll talk more about these last 2 points right now. So direct funding for COCs. COCs determine, like I said earlier, which providers and programs can enter into a cooperative application to HUD. So each year, more than 400 COCs apply to HUD for almost $2 billion in funding. And as part of the cooperative application, Providers often act as peers because they're coming together to apply in determining who is included and who is cut from the competition. So those are some tough choices they have to make. And how they do this strategically gets them points in their application. So if they cut out a low-performing program or add in a program that increases the likelihood of ending homelessness, they'll get more points and therefore more funding. And these COCs, through this competition, are applying for several types of services. The first and foremost is permanent supportive housing, which, as Mary said earlier, this is a housing subsidy coupled with supportive services. And here, HUD provides the housing subsidy, and the COC has to find other funds to put in place to cover the supportive services. And sometimes the housing can be in the form of a voucher. Other times, COCs have access to, or the nonprofits working in this area have access to master lease, which makes it easier to place persons with a lot of barriers because you're not dealing with landlords in this situation. COCs can also apply for rapid rehousing, which is shorter-term housing with services that also requires a bit of a match. HUD also funds transitional housing and supportive services through this competition, but has been pulling away from these in recent years. HUD is pulling away from transitional housing because it's not a permanent solution and requires households to move again at the end of a program. However, it does fund in certain instances. And it's also pulling away from supportive services because it's primarily a housing agency, and it wants other agencies to step up and pay for the supportive services. And finally, COCs can apply through this competition for HMIS administration and for strategic planning. And overall, the vast majority of these resources are meant for literally homeless persons. So these are people living in the streets or in a shelter, not people that are at risk of homelessness or those who are doubled up with others for financial reasons. And the rationale here is that poverty and the lack of affordable housing is a much bigger issue, and funding for homeless services is very limited, so it's important to target these particular resources to those most in need. This also means that people coming out of halfway houses or other transitional housing programs are typically not eligible for permanent supportive housing and rapid rehousing through this competition. But we can talk about other ways in which to get those resources here in a minute. So because HUD funding through the COC doesn't cover everything, COCs are actively partnering with other funders to direct those resources to make sure all aspects of homeless services are covered. And this goes from outreach to shelter to housing to supportive services. And they help determine with other funders how to right-size these services and use the funding most effectively. And typically, COCs work to secure match dollars as part of this competition. In addition, COCs work with the Emergency Solutions grantees, and this is a block grant from HUD to local and state governments that pays for shelter, outreach, rapid rehousing, and prevention. And here with rapid rehousing, people coming from transitional housing programs are eligible for rapid rehousing. So that's a distinction between ESG and the COC. Let's see, and supportive services, the Substance Abuse and Mental Health Services Administration has block grants and competitive grants that can help fund supportive services. However, these grants are definitely not enough to cover everything that's needed. So other match funds from state, local, and public or private sources are also part of what the COC tries to secure. And in many places, the Second Chance Act funds could be a strategic part of this mix. If you're able to put in more supportive services, that may free up other dollars for more housing. And finally, to talk about coordinated entry. Coordinated entry is relatively new. Here, COCs are required to create a system where anyone experiencing homelessness in their community can get to the services they need no matter where they show up. And this includes routing referrals from organizations or creating a centralized intake process. So for instance, in some places, you can just call 211 and you'll be screened and referred from there for prevention services or targeted housing or shelter as needed. And this includes all ESG, COC, and other funding sources. The hard part here is getting just enough information on the housing need and the eligibility of people seeking assistance and determining the priority of those people for services. And the whole point of this is so that people don't end up lost in the system or end up in the homeless system when they really don't need to be there. So in most places, coordinated entry or coordinated access or coordinated assessment, there's lots of terms for it right now, is still in development, which is why it's a great time for reentry folks to get involved. So you can work with COCs to establish who should be referred to the homeless and housing services system and how and when that should happen. And you don't want to send everyone you serve, obviously, through coordinated entry if they're not homeless, but for those people you serve that are homeless or will be homeless when they leave prison or jail, it means that they're more likely to get the services they need. Plus, in establishing coordinated entry, this is a good excuse to have an important conversation about who is responsible for individuals, the correction system or the homeless system, and hopefully your systems can come together to come to a good solution. So there are many ways you can partner with your local COC. You can sit on the COC board to create and implement strategic plans, or you can engage the COC leadership in your planning process. You can convene the COC and corrections agencies to plan for successful reentry and housing outcomes. Even just educating one another about your systems is really helpful, and this is probably the best place to start if you haven't already. You can also work together with the COC to serve frequent users through case conferencing or targeted interventions. You can share data between the Homeless Management Information System and the criminal justice system, and this will give you a sense of how much your systems overlap and how to create discharge plans and direct funding. You can prioritize people who would become homeless for your services. For instance, if you know someone's entered corrections while they were homeless, they will likely need housing support, so you can plan early on for housing before their release. You can also adapt your policies and procedures based on the unique needs of justice-involved persons who are also experiencing homelessness. And finally, you can pay for housing services, and this is really important. You may have the flexibility through your Department of Corrections or other reentry grants to pay for housing, even if it's just deposits or housing applications or other type of housing navigation services. And if you don't know how to do this, the COC can help you, and they can help you target those funds to those most in need. And finally, you can help them advocate for housing resources as well. It's really important to tell local leaders, especially funders, how important it is to understand that housing is a key component for a successful reentry. So for those of you not yet working with your COC, this slide has a link to where you can find the COC lead person in your community, and it's always a good time to reach out. COCs tend to be especially busy during the summer because of their application to HUD, but this is also when they are most keenly aware of strategic partnerships. So now is a particularly good time to knock on their door. Also, when they are advocating for state and local dollars, that's a good opportunity. So with that, of course, if you need more information, please feel free to reach out to us. My contact information and our website is included on this slide. And Maureen at the Justice Center has put together a great resource page on their webpage. So if you go to csgjusticecenter.org and look up Housing and Reentry Resources. That can send you to the same place. And we're also looking for examples of where COCs are working strategically with corrections or reentry service providers. So please let us know if you've heard of any of these examples. Hopefully the survey will allow for that, or if not, you can just email me. So thanks for everything, and now I will turn this thing over to Kim.
Great, thank you so much, Jamie. And yeah, so Jamie is now going to turn it over to Kim Keaton from CSH. Kim, please go ahead.
Hold on, I don't see Kim on the, oh, there we go.
Yeah, you got it. Thanks, Jamie, thanks, Maureen, and thanks, Mary. I appreciate the opportunity to be part of today's webinar. And I'm really excited to go a little deeper into what permanent supportive housing model for the most vulnerable of those reentering communities, need. And so I'm excited to kind of get down into the details here right now. My name's Kim Keaton. I'm a Senior Program Manager for our National Government Affairs and Innovations team at CSH. For those of you not familiar with our organization, CSH stands for the Corporation for Supportive Housing. So at CSH, we believe that supportive housing is a solution to helping people who face complex challenges live with dignity and autonomy. It also improves lives while maximizing public dollars, as referred to by Mary earlier in the presentation. Supportive housing is housing that at its core is affordable, so usually 30% maximum rent contribution by tenants. There's no time limit, so unlike transitional housing, supportive housing is meant to be permanent if that's what the tenant chooses. And it's independent. So it's not part of a program, or it's not part of a program that folks are mandated to. Folks have leases with landlords just like you and me. And it's combined with support services that help tenants get what they need. It's intended for people who, without the services, would not stay in housing, and without the housing would be homeless or incarcerated, as the case may be for this population. As you heard Mary discuss, it's the highest intensity intervention on the housing scale, and it should be targeted at those that need it most, since we don't have enough of it. So, supportive housing, the goal of the model I'm going to talk about today, which is called FUSE, is to reduce the revolving door between incarceration and homelessness. As you are all too familiar, people who leave jails and prisons, especially those with a mental illness or some other type of mental or physical disability or substance abuse, with no support or stable housing, end up in this revolving door, showing up not only in the jail and homeless systems, but also in local emergency departments, emergency transport systems, behavioral health systems, between the incarcerations and their stints on the street or shelter. CSH has a long history of testing innovative models of supportive housing that target new populations and involve new systems that formerly weren't involved in this work. When we came up with FUSE, we knew that for the most vulnerable of those cycling between jail and shelter, supportive housing was a solution that would help break the cycle. We've tested this model in communities across the country and have built an evidence base demonstrating that the combination of affordable housing with wraparound support services both resolves participants' homelessness and also reduces returns to jail or prison, among other positive outcomes like reduction in use of emergency health departments. So as both Mary and Jamie discussed, it's a really exciting time for those of us in the reentry field. First of all, there's a large push on the part of the Obama administration to really pay attention to this issue, in particular to reduce the number of mentally ill folks in our jails and prisons. And as Mary discussed, last year a NOFA for a demonstration program for permanent supportive housing was jointly issued by the Departments of Justice and HUD. The housing opportunity specifically is written to target this group of folks that are cycling between corrections institutions and homelessness. This particular program model was heavily influenced by CSH's FUSE initiative, which you'll hear about today. So FUSE, it stands for Frequent User Systems Engagement, and it's really a framework for creating supportive housing for a population that is shared between multiple systems. The framework really combines data-driven targeting, stakeholder engagement, and quality supportive housing to house the most vulnerable frequent users of public systems. What is FUSE? FUSE, Frequent User Systems Engagement. Frequent users are also called super users. You might hear them referred to as high-cost utilizers, super utilizers. They all mean essentially the same thing and refer to the thousands of people with chronic health conditions that cycle in and out of jails, are in our diversion courts, are being engaged by law enforcement on the streets, and homelessness at great public expense and with very, very few positive outcomes. By placing this particular group of people in supportive housing, we can improve the life outcomes for tenants, more efficiently utilize public resources, and likely create cost avoidance in crisis systems like jails, hospitals, and shelters. By finding a solution, to this issue, the FUSE approach serves as a catalyst for system change by taking stakeholders from multiple systems, allowing them to create a shared definition of who frequent users are, and forging a coordinated path in addressing the issue. This is a map that shows the spread of the FUSE initiative since its inception in 2007. The FUSE initiative was started in 2007, I'll just tell you a little story, in New York City. And in New York City at the time, the Department of Homeless Services and the Department of Probation actually shared at the time the same building. So the commissioners found themselves in the elevator one day together and jockeyed back and forth about how each one had the former inmates or clients of the other in their system. Oh, I have all your homeless people in my system, and no, you guys are, folks just come out of Rikers and they come to us. And so they decided to do a data match to discover what that overlap was. And based on that work, FUSE was born. I wanted to say, if you see a community in here that you are wondering about, or if there's one in your community that you have questions about, please feel free to contact me. My contact information will be at the end of my slide deck. So working with all those communities, I'm not going to talk about all of them. That would be a little tedious. But it's really helped CSH to develop a framework on how to approach this particular type of model. Each community has its own unique local context and conditions, but really at the core of FUSE are these three essential pillars. Data-driven problem solving is the first one, and I'd argue, except for the supportive housing, it's the most important one. Data is used to identify a specific target population of high-cost, high-need individuals who are shared clients of multiple systems like jails, homeless shelters, and crisis health services, and whose persistent cycling indicates the failure of traditional approaches. So usually this is done on the ground through cross-systems data matching to sort of identify who the shared clients are. Excuse me. Data is also used to develop a new shared definition of success that takes into account both the human and public costs, where the focus is on avoiding institutions altogether as opposed to simply offloading clients from one system to another. The second pillar is policy and systems reform. Public systems and policy makers need to be engaged in a collective effort to address the needs of these shared clients and shift resources away from the costly crisis services currently in use and towards a more cost-effective and humane solution of permanent housing with supportive services. On the ground, what this looks like is a stakeholder, multi-system stakeholder group that comes together to discuss sort of their piece of serving this particular group, small subset of folks, and troubleshoots barriers that these people experience as they are placed into housing, and hopefully retained and stay in housing and avoid interaction with the criminal justice system. And then finally, targeted housing and services, which we've discussed, is permanent housing linked to individualized support services, and is coupled with targeted and assertive recruitment through in-reach into jails, shelters, hospitals, and other settings in order to help clients obtain housing stability and avoid returns to the homeless system. And I'm not going to talk about creating supportive housing, and because that's largely what you heard Jamie discuss and how you can engage with your COC. It sounds easier than it actually is, but that's largely where all the FUSE programs are getting their rental assistance, although there are exceptions to that. So supportive housing is really, like I said, FUSE is for the most vulnerable justice involved. When it comes to supportive housing for justice involved people, we're talking about the people at the center of these circles. So if you can envision a data match between the Homeless Management Information System, which is what COCs maintain to track use of all the services in a COC catchment area, and match that against your local jail population, for example, there will be an overlap. And that overlap will be larger than the actual subset of frequent users. In the middle of the circles here, you're going to find the folks that are homeless, and their homelessness and jail patterns are repeated over time and well established. On the jail side, I wanted to point out what the system impact of frequent users is. And so this is from an actual analysis of a county's jail data. They had 24% of their entire inmate population in a year had stayed 4 or more times between the 5 years you see here. This 24% of users over that course of those 5 years had used up 58% of the bed nights. And when costs were calculated out using booking and per diem rates, they cost this jurisdiction nearly 2.5 times as much per person. This really underscores the fact that frequent users are a small subset of the larger population of inmates, and they take up a disproportionate amount of resources, and points to the need for deep targeting, data-driven targeting for this population. So I mentioned something called InReach. What is that? So now you've identified who frequent users are, and you need to figure out how you're going to find them. Because this group is spending time all over a community safety net system, it's critical for stakeholders to partner and collaborate on effective, quote-unquote, InReach into institutions. And that's what we mean by InReach. You're not doing outreach on the street or waiting for folks to come to you, but you're actually going into shelters and jails and hospitals to find them. By nature, this group is not a service-seeking population. They're not signing up for and completing the programs that help them. Thus, providers need to convince them to try a new approach. I know it seems crazy that you'd have to convince someone to accept what is essentially a free housing unit, but this is in fact the case due to several factors: traumatic experiences with programs, they've heard this before, often many times, mental illness gets in the way of rational decision making, and overall distrust of systems based on experience. For reentry service providers, it's critical to forge partnerships with stakeholders in all of the systems you see here. I mean, courts, jail, prison, but also the street outreach providers in your community, hospitals, detox, alcohol, drug treatment, shelters, continuum of care entities, and potentially psychiatric hospitals as well. When you are in when a FUSE initiative is basically going from a list generated from a cross-system data match, they come up with a way to interact and go into these systems. They forge relationships and discuss the program model and provide training, and hopefully gain access to these institutions of care so the most vulnerable can be reached. And so you've seen this slide before. Youth supportive housing is really the same as other models of supportive housing. Once housed, especially those that use the housing first approach that you heard about. Once housed, and often during the engagement period, the services are wrapped around the tenant and tailored to meet his or her needs. It's important to remember that acceptance of services is not a condition of tenancy for FUSE participants, but experience has shown that the vast majority of tenants engage in services. So I said that this program is evidence-based. FUSE reduces recidivism, plain and simple, and it also ends homelessness. By providing frequent users of systems with safe, stable, supportive housing would lead to increased cost savings, increased collaboration between systems, and hopefully systems change, a better quality of life for tenants and increased self-sufficiency, and it will decrease shelter usage, jail recidivism, and use of other public systems. I'd also like to say that it could also increase the quality of life for folks who work in jails and shelters who deal with the most vulnerable folks. The New York City program that I mentioned earlier was evaluated by Columbia University, and you see the chart here on the right. The program really showed that there were, compared to a comparison group over the 2 years that the groups were followed, the program group had 40% fewer jail days, 91% fewer shelter days, and 50% fewer psychiatric inpatient hospitalizations. This resulted, when all the costs were included in the analysis, a savings of $15,000 per year per tenant after the cost of the intervention was included. So to review, the key components of the FUSE model combine the things that you see here: cost systems, data-driven identification of a target population, assertive targeting, in-reach and outreach and recruitment, supportive housing. After the supportive housing, and I haven't really gone through some of these things, but there's more information on our website if you'd like to look at it. The stakeholders really implement a service coordination model and care management. In terms of demonstrating the effectiveness of an initiative, data is used to measure reductions in use and cost effectiveness, and hopefully to implement lasting systems change. So if you were to say, Kim, what do I do? How do I do this? These are the big three first steps that I recommend towards creating FUSE in your community. First and foremost, you need to, it's best to engage a local champion. That can be a police head, police department head, sheriff's office, a county commissioner, the COC lead, whoever is writing the application for the COC that Jamie mentioned, that's a good person, or a head of a reentry planning council that's looking to enact some evidence-based solutions for the reentering populations in your community. Secondly, identify stakeholders. Invite them to participate in a multi-sector planning group where you talk about the frequent user issue and discuss what sorts of resources that you all have to serve them in the community and housing. And finally, scan or create opportunities for supportive housing in your community. As mentioned, most FUSE programs are funded by COC sources, but there are examples of ones that are funded through project-based vouchers, through the Housing Authority is one example. Another is through county diversion funds, mental health diversion funds that are being used to pay for rent and services. So there's lots of examples that aren't just in the COC. Finally, I hope that you'll take the opportunity to visit CSH's FUSE Resource Center. There's a lot more there that I didn't have time to talk about today. Hopefully, though, there'll be some questions. It's www.csh.org/FUSE. You'll see a FUSE 101. You'll see more data on outcomes and evaluations of some of those programs, tools and resources, community profiles, videos, and the built-out blueprint, step-by-step piece of the blueprint that you saw earlier. And my email is down there on the bottom. Thank you, and that's all for me. Should I pass it back to Maureen?
Yeah, this is Maureen. Thank you so much, Kim. Yeah, you can hand over control of the presentation back to me. We're now going to turn it over to question and answer time for the remaining 30 minutes. If you do have a question, please type it into the Q&A box in your bottom right-hand corner. And for our panelists, if you'd like to answer any of the questions, please feel free to jump in, just take yourself off mute and try to answer it. The first question that we have, I'm curious to hear your responses to it, all of you, has to do with the definition of homelessness and who's eligible for services that they can get through the COC. In particular, are people exiting jail or prison technically homeless? Do they qualify for some of these services through the COC?
So this is Jamie from the National Reentry and Homelessness. And yes, there are some great resources on exactly what the definition of homelessness is. Just loosely, it is people that are living on the street or in an emergency shelter. People that are living in transitional housing do count as homeless. However, it differs in terms of whether or not they are then eligible for other housing services. People that are at risk of becoming homeless in terms of how imminent their homelessness will be. So if they have to move in, I believe, a 2-week period of time and have nowhere to go, those can potentially be considered homeless. And again, their eligibility for various services will differ. I don't know if Mary or Kim has more to add. Just to add really quick, I think the best way to get the information is to talk to your local COC providers. Depending on what years they applied for funding from HUD, their programs may have different eligibility standards, so it's difficult to lay out a hard and fast rule right now.
Hi, this is Mary, and I'd like to, I had to step out for a minute to grab a resource about the question about homelessness. Are we still on that question?
Yes, please feel free to answer that. Okay.
So the homeless definition for the final rule, which is 24 CFR 578, sheltered homelessness is homelessness that includes living in supervised publicly or privately operated shelter designated to provide temporary living arrangements. These facilities include congregate shelters, transitional living spaces, and hotels and motels. So if an individual is exiting a prison or some sort of incarceration and they're living in a temporary housing situation, they are considered homeless per the HUD definition.
Great, thank you guys so much. So just for a further clarification, can you address, a conception that if someone's been in a facility for longer than 90 days and they have nowhere to reside, does that person have to spend a night unsheltered or in a shelter before they qualify for some of these services?
I can speak to that as well. Just from the HUD definition, absolutely not. So if someone does not have a place to reside or a primary nighttime residence that is not designated for ordinary use for regular sleeping accommodations, and this would include like a car, a park, abandoned buildings, a bus or a train, they're considered homeless. So even after the 90 days, if they don't have a place to go and they have to sleep in a place that's not fit for sleeping, they're considered homeless and they're eligible for programs.
All right, great. Thank you so much. So we have another question specifically about working with the COC, especially, programming that's been established in a community for a long time. If someone is trying to sort of break into that and build a new partnership with the COC, if a lot of the spending from year to year is legacy in a way and that the money kind of seems to go to the same couple of programs or community partners, what's your advice for how an organization can kind of start a new partnership and try to work on getting some of that funding from the COC?
So this is Jamie, and yeah, that is a tough question. I think that some ways to think about this are you can start off with a data sharing exercise if they're willing, just to demonstrate how much overlap you have with the COC. If you're providing services to people that are homeless and you're a reentry provider and you need funding and you want to work together, I think that's one way to demonstrate that. Something else is, to go to other funders. So if you know your ESG provider in the community, sometimes they can have a different way of looking at things, and perhaps that's a good entry point. And then sometimes bringing in an outsider to speak to this is helpful. So if there's an expert locally or nationally that can come in and provide some perspective, sometimes that can help.
Great, thank you, Jamie. So kind of related to that, we have a question on how do you find resources locally? Obviously, we shared that website where you can sort of find this local contact information. But do you have any other suggestions on how to find local resources? And in particular, what if you serve a very specific subpopulation of folks in the criminal justice system, whether that's women or parents or people with substance use disorders? What's your recommendation for sort of finding local resources that might be targeted to a specific subpopulation?
So this is USICH again, and USICH put out guidance that I discussed earlier on connecting people returning from incarceration and housing and homeless assistance. And one of the primary thing it addressed is people who face collateral consequences from incarceration. And so we've really identified that a good starting point to identify and engage homelessness and housing providers is to get to know the planning bodies, the local continuum of care, the PHAs, and the city and county housing departments, and then from that point, work with housing providers to adopt more reasonable tenant screening criteria. So this would include ensuring that public housing authorities are aware of guidance that HUD has put out regarding appropriate tenant screening and arrest records, discussing facts and sharing positive experiences with landlords to help mitigate unfounded preconceptions, and also identifying concrete ways that service providers can provide support to individuals to mitigate risks to PHAs and private landlords. And then in terms of specific populations, oftentimes transitional housing is long-term congregate care. Transitional housing is a good intervention for people who have experienced substance use issues, people who are on sex registries or reentering from jail. And this is because time-limited or transitional housing can be useful connecting people to permanent housing effectively and efficiently. And it's a transitional bridge to permanent housing, but it also provides long-term support, and it's a much more structured and rigid type of housing. So before reaching permanent housing, it's a good intervention for folks that are looking to for more support in a temporary time.
Okay, great, thank you. So we're getting a lot of questions coming in. We're going to do our best to triage them. We are getting a lot of questions, and I know that this can be difficult to answer, especially in any kind of generalizable way, but I'm curious to hear from all three of you. We've gotten a lot of questions about access to housing or eligibility for some of these programs for people with felonies on their record or for people who are registered sex offenders. I know you've touched on that a little bit, but do you guys have any more information you'd like to add on eligibility for people with those types of offenses on their records?
So this is Jamie. I'll take a first stab, and hopefully Mary and Kim can help me out with this. So I think the sex offender issue is a huge one, and I know that the Council of State Governments did a webinar on this issue not too long ago, so I would recommend that people watch that. Continuums of care are, they're dealing with people that have a lot of barriers, and part of what they're trying to work out is how to create accessible housing. So they're working with landlords constantly. They're trying to find housing resources that, like master lease, where you don't have to work with a landlord. You can just place someone with high barriers into that housing, and so that creates some flexibility in the system. But I know that HUD is also coming out with guidance to talk more about these issues for people with felonies, so that they're not being denied housing just because they have a felony. There needs to be other evidence that people should not be in that housing. So I think that's something to use, and maybe you can go to your housing advocates with that guidance, and maybe we can include that as part of the resources for this webinar, and that walks through when public housing authorities and when private landlords can and cannot reject people based on having a criminal record.
This is Kim. I will just second what Jamie says. The biggest tool you have is information about the guidance that federal agencies have put out, and then also, in sort of having a way to communicate to landlords that these, that it's okay to rent to these people. I will say that in particular with permanent supportive housing, like I said, folks have leases in the community just like me or you, but the fact that somebody is has these support services wrapped around them, so, somebody's visiting them, somebody is available to them at any point in time, that really is a way of convincing landlords that this is the right thing to do, because it creates sort of like a little bit of a barrier between a landlord who may be reticent to rent to those with felonies and the tenant, and creates a sort of a layer of accountability.
Okay, great, thank you. We're getting a lot of questions coming in about, specifically about the definition of homelessness still, and sort of who qualifies for what services that are HUD funded. I think a good way to address those questions when we do post the recording of this webinar, and we'll also try to make available a PDF version of the PowerPoint slides. We'll also be sure to include in that posting a link to that definition and some additional resources about how eligibility is determined for individuals who have maybe spent longer than 90 days in a facility. So our next question, and again, we're getting a lot of questions specifically related to program design, and a certain community has a certain set of programs in place, and what's the advice for moving forward. But a particular question that we're getting is about what can departments of correction or community corrections do to help plan for housing needs before someone is released from incarceration. Do you guys have any recommendations, or is there any known best practice around housing planning for someone maybe at risk of homelessness or with a history of housing instability before that person is released back to the community?
So I think I can take an initial stab at this question. The Department of Justice published a roadmap to reentry tool which provides guidance to the Federal Bureau of Prisons on how to reduce recidivism. And the Roadmap to Reentry encourages prisons to provide every person leaving custody with an individual reentry plan tailored to that person's risk of recidivism and their needs. And so the Roadmap to Reentry is a great tool at providing a best practices at the point of intake to incarceration and also through release.
This is Jamie. I think it's really helpful when departments of corrections are really open to sharing data and understanding how much overlap exists. If they know that people are coming in from the homeless system, if they're being arrested and put into jail or they're incarcerated and they were homeless right before, it's likely that they're going to be at risk of homelessness when they leave. So a housing plan, getting started on that right away is helpful. Having a relationship with the Department of Corrections and local service providers is helpful for doing that. So if, someone can call 211 and say, hey, Joe's coming out of this prison system in a couple of months. He doesn't have anywhere to stay. Can we put him on a list? That just gets the process started. Coordinated entry systems are right now working on housing assessments and how to prioritize people for services. So I think understanding how those work locally will help corrections to know when to insert themselves. So that's important information. And also, as we said, departments of corrections, they can pay for housing. And I know that they don't usually take responsibility of people when they're no longer on parole or probation, but those are important times. And so I think they can contribute some general fund money towards housing or services and work closely with other service providers to make sure that people reenter successfully.
Great, thank you. So we're also getting some questions about, for example, people who are registered sex offenders or who have felonies on their record, if there are state or local restrictions or bans on getting those individuals into affordable housing or homelessness services that are maybe at a discretion over and beyond what's federally required. What advice, if any, do you have for communities who are maybe trying to increase the availability of services for individuals who are maybe automatically banned from certain services? Is there any kind of guidance on how to begin to roll back some of those discretionary bans where it's appropriate?
I'll just jump in. This is Jamie again. I honestly found that the webinar that CSG did earlier on sex offenders was extremely helpful in terms of education. So the initial portion of the webinar talked about what we know and what we don't know about sex offenders, and I think there's a lot of misinformation out there, and so maybe some advocacy and some general education would be a great first step. And then also, if we're going to end homelessness, we need to be able to house everyone, and so it's in everyone's best interest to come to the table on this issue and work out ways in which you can find housing that is owned and operated by a nonprofit that's willing to provide that kind of housing, if that's what it takes.
And this is Ken. I would just add, too, that in particular, as the question relates to resources controlled by housing authorities, as we talked about earlier, HUD has provided guidance that they should be not barring those with felonies out, on their face of just accessing housing, and they've provided a lot of other guidance. Although they do allow local housing authorities to create their own sort of rules around that. And knowing about those rules, particular to the housing authority, is really important. So every housing authority on their website, you can look at their administrative plan, and administrative plans have those rules. You know, there are plenty of examples of housing authorities that have rolled back some of their rules contained in their administrative plan in order to create more access. And so I find that finding those examples, whether it's, you know, by attending webinars like this, contacting Jamie or CSH, we do actually some federal work on this stuff. It's really powerful to have those examples of housing authorities and communities that have actually made an effort to create access. There's nothing like peer learning.
Great, thank you, Kim. Some of the other questions that we're getting, I think, are kind of perennial problems for a lot of communities, which have to do with either, you know, getting more money to try to provide housing for individuals exiting jail and prison, or how do you get essentially more beds. So especially if someone wants to start a new program or maybe do some build-to-suit housing for people with records and housing instability. What are your thoughts on that? If a community just wants to start new programs, maybe do some build-to-suit housing, are there any resources available for those communities?
This is Jamie. I hope so. I think if what you're proposing to develop is filling a need and it's a best practice, and yeah, I mean, there's a lot of pay for success kind of momentum going on right now, and so that might be something to look into. If you're trying to innovate, there may be some foundations or local entities that want to pilot ideas. So that might be something where you just try it out to make sure it works before you scale it up. We're still trying to scale up things that we know work, like permanent supportive housing. So I think part of it's innovating, and then the other part of it is just really trying to fit in with what's already happening on the ground. And so if you're really adding an asset to your community, then hopefully that would be embraced. And particularly true the COC.
And I think that identifying gaps in resources and expanding the supply of housing options is critical, and it can't be understated enough. And I think ways to do that are using the criminal justice resources to fund short-term rental assistance programs like rapid rehousing, financing and creating new permanent supportive housing programs, for example, for frequent users of jails and homeless services, and then asking PHAs to adopt housing choice vouchers or public housing admission preferences for people who are justice involved and are connected to services and supervision.
Yeah, and I would also add that housing does not have to be built from the ground up all the time in terms of, you know, creating a new residence or rehabbing a new residence. Many of the vouchers available through Continuum of Care are what we call scattered site, especially for permanent supportive housing, and rapid rehousing is like this too, where the voucher is attached to a rental unit that anybody could live in. It's not specifically designated for any specific population. Those kinds of things, those vouchers allow programs to get off the ground really quickly.
Great, thank you. Just as a note to the audience, we know that we are getting a lot of questions about sex offenders. You know, it's such a complicated topic, and just so that everyone is aware, I think that the Justice Center and some of our partner organizations plan on providing more resources on this in the future, whether that's through, you know, papers or webinars or other media in the future. We plan on providing a little bit more of that, so I'm sorry that we're not able to go as in-depth specifically on the topic of housing for registered sex offenders during this webinar. But we do see your questions, and we're going to try to address those as part of a larger suite of products in the future. So we do also have a couple of questions coming in, again, sort of specifically to, like, what steps do you take to initiate programming or to make changes in how programs are structured? And I'm curious to hear from you guys, maybe Jamie, especially the COC perspective. you know, these COC boards, what exactly do they do? If you attend their meetings, what does that look like? Sort of what are the mechanisms through which COCs solicit feedback from the community or from potential partners?
Yes, so they should be having an online presence or a way to get in touch and provide feedback. That's part of their governance structure. They typically have monthly meetings, if not more, and there's various subcommittees. I mean, every COC is probably a little bit different. But I think the real work comes into the application. So I think the application process is pulls all of the pieces together because they have to report on their various plans for discharge planning, their strategic plans for ending homelessness for chronically homeless individuals, families, youth, veterans. So when they're putting all of those pieces together, they really do rely on their partners to help them come up with discrete things and next steps. They also have to report on their partnerships. So again, this is why it's a kind of a good time to be talking to them because they're having to go through that checklist of, you know, are we talking to corrections? Are we talking to reentry? And they're also looking at their data quite intensely. And one thing that's interesting about the Homeless Management Information System is that it does not collect information on someone's criminal record, so they really don't have a sense of criminally justice-involved persons unless they add that component in or unless they're actively data sharing. So I think, you know, taking that information and even just meeting with the leadership on the side is a great way to start a conversation. So yeah, in terms of meeting, I think, you know, I've been on a COC before, and we had people that would just come and sit in and talk about their programs and their interests, and the COC should, you know, hopefully find a way to fold them in. And sometimes those meetings can be less helpful, and sometimes they can be more helpful. So it just depends on how their governance is structured.
Great, thank you. You know, kind of again on the programmatic side, if an organization anywhere in the country has a question about a specific individual and they're unsure what types of services, you know, housing or homelessness related services that person might be eligible for, or sort of where to route that person next, what would be your recommendation for how to get, maybe how to get answers on a specific person, or if someone's maybe a unique case? What do you recommend?
Well, for places with coordinated entry established, which may not be as many yet, but everyone's pretty much in the works, they're trying to work through this. So they should have a system in place where they're accounting for all the services available, all the various eligibility criteria that is associated with those services, and how they as a community are prioritizing. So whether or not, you know, if someone's eligible, that doesn't necessarily mean that there's enough of that resource. So I think, you know, if you're wondering about a particular case, you may want to find the coordinated entry point. So some places this means calling 211, other places this means going to a walk-in center, call your local shelter, just see where you can hit the homeless system, and they should either have in place or be working intensely on figuring that question out for you.
And I think another idea is to contact your local HUD field office. And there's also on the HUD website, HUD CPD Ask a Question Help Desk that can provide additional information.
Great, thanks guys. I know that we're kind of winding down to the end of our allotted time for the webinar. I just wanted to add a few things. So for those of you in the audience, this webinar is being recorded. The recording of the webinar should be posted to the CSG Justice Center website within 2 weeks. We're also going to try to have a PDF version of the slides available in that posting. And we're also going to try to include some other resources that you may find helpful. For example, some information on the definition of homelessness, who's eligible for different services, how you can find your local COC contact, how you can find your local HUD field office. I think that it'll be good to have all of that information in one place. So if you've attended this webinar, you should have access to all of that information via the CSG Justice Center website within a couple of weeks. Other than that, I think I want to extend a big thank you to all of our presenters today. Mary, Jamie, and Kim, it's been really informative hearing from you. I think the quantity of the questions and interest that we got in this webinar proves that there's a lot of interest in moving this topic forward and helping to eliminate housing instability and homelessness among people exiting jail and prison. So we very much appreciate you guys taking the time to present your and your organization's expertise today. We really thank all of our audience members for dialing in and listening to us today. If you didn't hear your question answered, we did get it. We will take that into consideration when we're posting things later. Obviously, the contact information for myself and all of the presenters is available online. And with that said, I just wanted to quickly remind everybody that when you exit the webinar today, a very short survey will pop up. It's very quick, only 5 questions, should take you less than 1 minute to answer. And with that said, thanks very much everyone for joining us today, and we'll look forward to discussing this topic more in the future. Thanks everyone.